So today's workout is going to be in the side lying position, and we're going to need either a Pilates ball, a yoga block, or even a little pillow, like a little meditation pillow or something like that. So basically just something that you're going to be able to squeeze in between your knees. First position we're going to go into is side lying. So we're going to come here. I just have a little pillow here for my head. So the first exercise we're doing is hip abduction. So what we're doing is we're coming up and then back down. So make sure that you're in a line. Make sure that you're not rotated forward or back, or that your leg is in any other position. So I actually want it to the side and slightly behind you so that we're getting that glute in the back, okay? So as you come up, that's when the effort is. So that's when we're going to be doing exhale, engage deep core pelvic floor, and then we inhale, lower. And then exhale, draw in as we lift the foot up. And then inhale as we lower. So exhale, lift, draw in deep core pelvic floor, inhale, lower. This is 5, inhale. Exhale, engage, inhale. 7, 8, 9, 10. Okay, so you're gonna grab the ball or pillow or yoga block or meditation pillow that you have. You're gonna put it in front of you, and that leg that was just on top, you're gonna bend it and put it on top of where the ball is, and that back leg, now you're gonna straighten. Okay, so the movement we're doing here is now we're rotating. So make sure this leg is at a 90, okay? So as best you can, so make sure that your leg isn't out or back in. So the movement we're doing is we're bringing the foot up and then back down, okay? So as we bring the foot up, that's our exhale and that's our effort. So that's when we're engaging, and then when we breathe in, we let go. So start with a breath in. Exhale, bring the foot up, then inhale, lower. Exhale, engage deep core pelvic floor, lift the foot up. 3, inhale, lower. Again, this deep core and pelvic floor engagement is around 30%, so you're not squeezing as hard as you can. It's just activating the muscle through movement. Good. Okay. 6, 7, 8, 9, 10. Good. Now you're gonna put your body in that clamshell position. So feet, hips, shoulders are all in the same line. You're gonna place that ball or yoga block or pillow in between your knees. And what we're doing right now is adduction squeezes. So you're squeezing around 50% of your strength. Hold for 5 seconds, and we're doing 5 reps, okay? So when we squeeze the ball together, that's an exhale. That's when we also engage deep core pelvic floor with that squeeze. So again, this is not squeezing as hard as you can with all of these. We're just trying to coordinate these activations, okay? So you're gonna breathe in, relax the knees, relax deep core pelvic floor, and then exhale, squeeze the knees, engage pelvic floor, deep core. 4, 5. Now inhale, release everything. Exhale, squeeze, engage deep core pelvic floor. Good. Inhale, open, release. Good. Now exhale, squeeze and engage. Inhale, let it go. Exhale, squeeze. 2, 3, 4, 5. Last one. Breathe in, let it go. Exhale, squeeze. Inhale, let it go. Okay, so now back to the top. So now we're gonna come and do the exact same thing, but we're gonna do everything on the other side, okay? So we're gonna come up. Okay, if you're laying down, you can just roll over to the other side, or you can flip over. And now we're doing the same thing on this side. Okay, So what we started with was bent bottom leg, straight top leg. Your leg is going up, but slightly to the back, okay? So as we come up, that's the effort. That's when we exhale, engage deep core pelvic floor. So as we come up, we're gonna start actually with a breath in. And now exhale, bring the leg up, engage deep core pelvic floor. Inhale, lower. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Grab the ball, place it here. Again, now we're gonna straighten the bottom leg. This leg comes up, okay, stays at a 90. And now what we're doing is, again, the effort is as we lift. So whenever we lift up, that's when we engage deep core pelvic floor, and then we bring it back down. Inhale, lower. Okay, so we're gonna start with a breath in. Exhale, lift, engage deep core pelvic floor. Inhale, lower. This is 6. 9 and 10. Good. Okay. Now we're going to bend the knees. You're going to get in the clamshell position. So feet are stacked, hips are stacked, shoulders all in a line. What we're doing is that 50% squeeze with our knees as we engage deep core pelvic floor. So to start, breathe in. Exhale, squeeze. 3, 4, 5. Inhale, let it go. Exhale, squeeze, engage deep core pelvic floor. Good. Inhale, let it go. 4, 5. Good. Inhale, let it go. 2 more. Squeeze, exhale. And last one. Good. Okay. So we're going to remove the ball. Now we're going to do a hip rotator stretch called the pigeon pose. So to come up, you're going to come up on your hands and knees if you're able. Okay. And in this position, you're going to straighten out one of your legs and the other one comes up. Okay. So you should be in this position to stretch the hip area here. The leg here, I have it placed so that my foot is at a 90 degree. If you can't do that, or if it's hard for you, what you can do is bring the foot in a little bit and then kind of sit over that foot if you can. Just so I can show you, let's go front. So coming up like this, in a perfect world, the foot should be up like this and us placed like this. So we're trying to get into that. Drop the hips here. If you can't do that, then you can bring the foot a little bit more so it's kind of where your pubic bone is. So you have a little bit more support, and that's if it's tighter in your hip or in your knee, so you can do this. So progressions and regressions. This would be a regression. A progression would be if you can do this and then lower your body. Okay, so we're doing a 30-second hold right now. If you've already been doing it, we only have a few seconds left. Here we're not coordinating our breathing, we're just making sure we're breathing. Okay, so now you're gonna bring the foot back, okay? And now the other leg comes up. So straighten the back leg, this leg comes up, okay? In a perfect world, try and get your foot out, okay? And then come as low as you can. If you can't do that, bring the foot back in towards the midline, kind of where the pubic bone is, and then you can kind of stay in this area or even come down a little bit, totally up to you. So we just want to get some mobility in through the pelvis and the hips with this exercise. So maintain your breathing. Pop this up. Okay, now we're gonna stop that. We're gonna do the same thing on the other side. One more rep. Okay, so foot's there if you can tolerate it. Same idea. The idea too is that you want to stay straight. So right now I'm over that back leg. I'm not leaning towards one side or the other. I'm right on top of that back leg. This leg is here, so we're coming up that way. All right, and now switching. Same idea. This comes up. Okay, if you can. Same idea, you're on top of that back leg, okay? You're not rotated one way or the other. Try to relax them through your shoulders. Five, 4, 3, 2, 1. All set. So just finish with a little thank you for allowing your body to do this, and we'll see you soon.